Hi, my name is Danielle Matus, and I'm here at Caring Medical Florida reviewing a case with you that I saw recently. And why I want to review this case is actually because this is a very common thing that I see at Caring Medical. So this patient was a 36-year-old male with chronic knee pain. So he had actually tore his MCL, that's the medial collateral ligament on the inside of the knee. Basically that ligament's job is to help stabilize the medial knee. And he had tore it 10 years ago. Didn't necessarily address it, just kind of let it try to heal on its own, but he really had chronic pain since then, popping in his knee when he was walking, unable to do lunges, one-legged squats, work out the way that he wanted to. So he came into our office and we did a dynamic ultrasound. So we use ultrasound to help diagnose things like tears, if there's swelling, soft tissue injuries, but then we also do a dynamic part of it, meaning that we move the joint under real-time ultrasound imaging to help determine if the joint is unstable or stable. In this ultrasound image here, so these white lines right here, those are bones. So those are the bones of the medial knee, the tibia and the femur. And this right here, that's the joint space, okay? And that's where the meniscus is. This kind of thick tissue right here is the MCL. And I say thick because in this patient's case, the ligament is actually thicker than what's considered normal, which is common in these chronic injuries. So usually as ligaments and tendons degenerate, they actually do get thicker, which, you might think like they kind of degenerate and wither away to nothing, but we'll actually see them thicker on ultrasound. And a normal, healthy ligament should be kind of like bright white lines throughout. Again, I'm trying to keep ultrasound really simple, but you can see here, just even with anyone's eye, this deficit or defect in there. That is basically a chronic MCL tear. This is the dynamic part of the ultrasound where I'm doing a valgus stress test and looking to see basically how much that joint space opens. So what we'll actually see is that the space between these bones gets wider as I do that. And you can see how it opens and closes. So in this patient's case, he does have a medial knee instability. So there has been a chronic laxity in that MCL that's basically not holding that medial knee stable and allowing it to move more than it should. Some key points of this case. Dynamic imaging, dynamic ultrasound is so helpful in helping us to get a clear answer of what's going on in this patient's knee. Why is it swelling? Why does somebody maybe feel like their knee is giving out? It gives us a true idea on how loose ligaments are surrounding the joint. In cases where there is, medial knee instability, such as in this patient, prolotherapy is indicated to help strengthen and tighten those ligament tissues and restore stability. And it is possible to overcome your chronic pain. So like I said, this patient had had pain, for at least 10 years. After one treatment, they had visited DC on vacation, and he said one day they walked 20 miles. Now, that's a little crazy in my opinion, but even just after one treatment, he was doing so well that he was able to do that. And he said he would not have been able to do that or keep up with his friends prior to treatment. And that's really our whole goal. Our goal is to get patients back to the activities they love and graduate them from prolotherapy. It's not designed to be this long-term, drawn-out, years and years of treatment type of thing. It's supposed to be, let's get this patient better, reduce their pain, increase their function, and let them live their best life.